This government meeting is brought to you by Eastworks and our local cable subscribers.
But I'm just going off what the information I was given by Allison, and I believe Lindsay too. It was discussed that camp was going to do it, but they're still, the plan was for them to do camps, but they're still figuring out, exactly how to do it.
Okay. All right. I guess we're going to have to figure that out, because Northampton sent an email today that Director Hutchinson had talked at that meeting today and said they would not be doing camps for us. So I'm not sure who Amy spoke to during that meeting, but.
Yeah, well, I had, Christine and I, we tagged along. Sorry, go ahead, Jackie.
Excuse me. It's 5:30. Do you want to start the meeting and then we can continue that during the health agent report?
Sure.
Okay. Amy, did you get the printout for what you need to say, the little spiel that says you're being recorded?
Yeah.
And okay, you can start.
Oh, there's nobody in the waiting room. Everybody's in.
I don't have anyone in the waiting room that I can see.
Great. Okay.
So everybody.
I guess I will open
Everybody's
the meeting. Do we vote to open the meeting, don't we?
Yep.
Yeah. So
Somebody makes a motion.
Beth, you want to make a motion to open the meeting?
Beth, you're muted.
Okay, sorry, thought I was unmuted. You can hear me?
Yes.
Okay, I'll make a motion to start today's Board of Health meeting, March 20th, 2024 at 5:31 p.m.
Great. And I'll second that out of necessity. So all in favor, Amy, yes.
Beth, yes.
Okay. In accordance with Mass General laws, we are required to let everybody know that this meeting is being recorded. We will begin the meeting with 15 minutes of public speak time, and that will allow 3 minutes per speaker. Raise your hand if you would like to be recognized by the chair. Please note that during public speak, the board will be actively listening to your input for future discussion, but we will not be responding to any comments at this time. Please do not speak unless recognized by the chair, and all comments should be addressed to the Board of Health. You also can submit a question or topic for later discussion via email to the health@easthamptonma.gov email address. And it looks like at this time there is no one here for public speak.
No,
So,
I don't see anyone.
not seeing anybody, we can move on to, is Lindsay with us yet? No.
Not yet.
So we're gonna, Beth?
Yeah.
Can you make a motion to move out of order?
Yep, I'll make a motion to move out of order on the agenda.
Great, I'll second that out of necessity. Amy, yes?
Beth, yes.
Okay, so we're gonna move to approve the meeting minutes from 1/17/24. I had no concerns or items for discussion. How about you, Beth?
I did not. So I'll make a motion to accept the meeting minutes from the last board meeting on January 17th, 2024.
I'll second that out of necessity. Amy, yes?
Beth, yes.
All right, rolling right along. Board of Health member search, update the Board of Health. That probably is Lindsay.
Actually, well, maybe, but I have some information on that. We still don't have a Facebook page for the health department to be able to post the openings on a regular basis. The city has posted it a couple of times. It's on the website. In the past, what we've done is got a list of census people in the city from Barb, the clerk, and sent out mailings saying, hey, we have a vacancy. Are you interested? In the past, we've narrowed it down by occupation, depending on what we were looking for. In January, you all had mentioned, or maybe December, social worker. And I spoke to Barb. She just got an updated census, so everything is up to date. She can spit me out a census for social worker type people. And then we can mail out a letter that says, hey, we need a board member. This is the process. Are you interested? I just need to get a letter from somebody that gives me the rundown of what they want to say. That would probably be Lindsay.
Yeah, I mean, I think if we're going to have any discussion, it's really like if we're going to try to go the census tract route, what professions are we going to pull? Because unfortunately, I don't think public health is a response on the census tracker.
Right.
I think ideally what we really need is like someone else who understands regulations and local board of health. You know, I mean, Beth carries the medical piece for us, and she carries it with gusto and professionalism. I can carry the local public health experience, but it's always nice, like when Brian's coming to us with a hearing or whatnot, to like have two people who really understand the regulations. But I don't know how.
What would be job descriptions? I mean, if you want to think about it, you and Beth want to think about it and send me a couple of possibilities, and I can throw them at Barb and she can spit out, names.
I think
an
the
address.
best description would be jack of all trades, master of none. Brian, doesn't that kind of sum up what we do on a daily basis?
Yeah, definitely.
Yeah.
I don't think that's one of the boxes you can check.
It should be.
I know.
Okay. I mean, I think for like boxes you can check, a social worker, or, I mean, public health should be an option on a census tract, really.
Okay, I'll check with Barb.
Okay. All right.
Okay.
So Beth, do you want to make a motion to move back to agenda item 2 now that Lindsay's on?
Sure, I'll make a motion to move back to agenda item 2.
I'll second that out of necessity. Amy, yes?
That's yes.
All right. Lindsay, welcome to the Board of Health meeting.
Hi, thank you. Sorry, I'm just getting out of dance class with my daughter, so I'm running a little behind here.
Totally fine. We have all been to those practices or sessions where the kids just like don't get off the field or into the car. So I understand that experience. So we have moved ahead in the agenda, but as you heard, we just moved back and to collaboration with Northampton Shared Services. So I'm not sure if that's something you want me to speak to, or if you wanted to speak to it.
If you want to kick it off, that would be fine with me.
Great. So I guess, Beth, this is primarily for your benefit. So, or because I think everybody else knows, but if not, I guess everybody. We are, as you know, short a director. We are have not been able to hire for a part-time inspector that has been budgeted for this fiscal year. And we're on the precipice of Brian being out on parental leave sometime this summer. So our environmental health services has kind of found ourselves in a rough patch here. So Lindsay and I have been brainstorming ways that we might be able to utilize both the shared service arrangement that we're already a part of with the city of Northampton, or collaborate with them on a more formal level in terms of just outside of the shared service arrangement and more just like the city of Easthampton partnering with the city of Northampton. So Lindsay and I have been engaged in meetings with the public health director over in Northampton, as well as I think their chief of staff for the mayor, to talk about ways we might be able to partner and collaborate to ensure that all the hard work that Bree and the rest of the department has done over the last couple of years to get us caught up and in alignment with the performance standards that the state has issued isn't lost. We don't fall back behind, which is where we were before Bree got here, is pretty far behind. So Beth, I'll stop there. That was pretty high level, but I'll stop to see if you have any questions about the work that's been done or the kind of the process that we're engaged in.
No, I don't have any questions.
Okay, I do. All right. So where it stands now is it seems like the shared service arrangement that we're in is stepping in and really supporting with some of the food inspections that we're behind on. So that has already happened. Brian and the inspectors from Northampton have a shared tracker that they're utilizing to ensure that they're not duplicating efforts. Brian, you can jump in and correct me if I'm misstating anything. Yeah, I'm good. Okay. So they are utilizing a shared tracker. So, they're prioritizing some of the high risk establishments. That includes anyone with a HACCP plan or anyone who hasn't been inspected in a year. The schools are required by DESE to be inspected twice a year. So just making sure that those things are anything we're required under Mass General Law to do with a certain frequency is getting caught up on. But separate of that, we are looking at a summer of increased temporary events and camps that are coming up. It seems like there might have been some discussion that the shared service arrangements were going to take over supporting us on our camp inspections this summer. But today, there was discussion during a training session in Northampton that would not be happening, that the shared service arrangement that we're currently part of is not currently equipped or staffed to be able to take over the significant lift that our camps have. I mean, Easthampton is a community that has a lot of camps in it, which is a demand on our health department staff. So one of the things that Lindsay and I have worked on is a short-term sharing arrangement with the city of Northampton to help step in and help us support us with this process, as well as a potential long-term sharing arrangement for helping to think through ways we might be able to structure this department to be as efficient and effective as possible, while also staying in kind of the vision that we know the state has for the way that health departments function moving forward. So those are discussions that Lindsay and I are engaging with the health director and the mayor's chief of staff. Lindsay, am I missing anything?
No, I don't think you are, but I would like to make sure that staff is feeling comfortable and having conversations about this too with us. Because I know there have been communications with previous directors about feeling some uncomfortability around shared services and job position. Hold on, honey. And I'm sorry, guys. And job positions. So I just want to make sure that staff is feeling comfortable and knowing that nobody is going anywhere. And this agreement is really to just help make the health department a little more robust right now and get us to where we need to be. So I welcome staff to kind of jump in and talk about this.
Yeah, and to that point, so before people jump in, I know I would also like to reiterate, just from my position at the state, knowing that the goal of sharing services is never to eliminate positions, it's to create efficiencies and economies of scale in terms of what it is we're doing and how we're doing it. So I would really love to hear if people are afraid for their positions or concerned about anything, especially around that, because I'd love to be able to talk about it and kind of help support that. All right. Well, I think we're supposed to leave 30 seconds, so I'll sit here for the 30 seconds in case anybody wants to build the courage up to have this conversation.
I just want to express that I know that me leaving in June kind of causes some some problem, not necessarily problems, but some things to figure out, especially with the inspections. Over the next 3 months, I'm here to assist and do whatever I can to help the transition of me leaving. I want to leave everything running as smoothly as possible and the best I can do with that. So
yeah, Brian, I appreciate that. And really, being a dad is going to be the best job you ever have. And so taking those 3 months and really connecting with your child is really where the priority should be. And as you can hear, Lindsay's with her kid, my kid's running around, Beth sometimes has her kid. So, I think that is totally understandable, and this should never be something that you have to worry about on our side. And we appreciate the fact that you're committed and involved and want to leave us in the best place you possibly can. That's all we could ask for in this situation. It's all happening with the loss of Bree and then the loss of Allison, and then not having been able to bring on an inspector who is qualified at this point. So none of that is of any fault of yours. So we appreciate your efforts in trying to keep us on target before you leave. Lindsay.
I'd like to also echo that, Amy, and to the entire staff, because the health department, along with other departments, has been undergoing major transitions lately. And you guys have been working diligently and independently to keep the department afloat. And it's recognized by the mayor's office, and we appreciate it. So I know we don't stop down all the time, but please feel free to come to us for direction or support, and we are here.
I think the comments that had come up, we had a grant meeting yesterday, and I think the discussion, Allison is part of that grant still, and I think the discussion that came up, she was not aware that we were not posting for a new director. And the conversation came up about like, well, why are we not posting for a new director? Well, we're going to be getting a consultant. And I will say, I was at a conference in Northampton today, and numerous people said like, hey, what's the status of your department? What's the status of the director position? And like, we're not hiring a director right now. And so I think the big unknown is like, when are we getting a consultant? Are we going to be like talking with this person about the direction of the department? And with that, the last two directors that we had very different approaches to public health work. There was a lot of similarities, but there was a lot of like, Allison came from a very different place than Bree came from. Bree came from being a health agent. Allison came from like community public health background. Like, what is the goal, the direction? If we're going to be moving in the direction of like what Northampton is doing, Northampton has a Department of Health and Human Services, is a very different model than what we currently have in Easthampton. So I think it's just a lot of the unknowns was where the discussion about like, where does everybody fit in that, as opposed to like, I don't think anybody thinks their job is going out the window in Easthampton. I think it's just more the discussion of like, what is the status with the director? What is the status with the consultant? Like, what is the long-term lens of what Easthampton Public Health should look like, and how that all works out. So that was the discussion that had come up during the grant meeting yesterday with Allison. And I think she had just said like, oh, I didn't realize we weren't, we're not posting for a new director. We're having a consultant. What's the goal of the consultant? And it kind of like went from there.
Yeah. Well, Allison wouldn't know all the things that are happening because she's no longer the director. So her not knowing that makes sense, right? Like that she's not part of these discussions. But I'm happy to share that I don't know if we have a direction yet. We're really trying to look at the needs of the department and use this as an opportunity to reassess how we can best serve the residents of Easthampton. And hiring a director that we know isn't out there, right? Like we know that there's not really someone out there that can fill the needs of this position right now. We've had a hard time even finding an inspector to fill those needs. So we can keep posting and keep getting candidates that aren't what we need, or we can take this time to like say, let's look at where the state is taking us. Where is the shared service arrangements that we're a part of already taking us? And how can we use this opportunity to figure out how do we build a department that serves the residents of Easthampton in the most beneficial way possible? So, and Lindsay can speak from the mayor's office, but I can speak in the conversations that I have. There's no definitive decision. There's no decision that has been made at this point about what that approach is. The conversations that are being had are with Northampton in terms of what could we share as a resource of each other, and what do we actually need to have in-house. And if we are to start serving on a more robust level, what that means for internal staff, we don't know any of those answers yet, but we will. As soon as we start to have any kind of pathway in mind, you guys will be the first that we're communicating and chatting with that about. there was another piece of your question. Oh, they have a very different model over there. I think was the other piece that you mentioned. Is like, yeah, so Northampton does have a health and human services model. And I think Easthampton has been building towards that. I mean, we have the social worker, we have like the nurses, we have the youth coordinator, we have all of the pieces, but we don't have a department that's structured like that. So we also know that the state is moving forward with creating a system of local health departments needing to not only achieve what the performance standards are now, which is just what's required by Mass General Law and regulation, but also the national model of the foundational public health services that is currently, it exists across the country. Massachusetts just doesn't have a mechanism for that yet. And SAFE 2.0 is looking at exactly that. So how do we as Easthampton put ourselves in a situation that's going to allow us to have access to additional funds and additional services from the state as they move in that direction? That's really something that I'm, as a resident in Easthampton, I can see that our department was going there anyways. We know where the state is taking us. So how do we position ourselves to have the most successful department possible at the least expense to our residents, to put ourselves in compliance is a strong word, in alignment with what the state is going to expect of us anyways. And that's a lot of balls to be balancing at once, while we're also trying to help support you guys to do the job that you guys are trying so hard to do within the department. So I don't know if Lindsay has anything she'd like to add to that.
No, I appreciate everything you said, Amy. And I apologize. I thought I had communicated that these are things that are in process and that I would let everyone know as soon as we had direction. Because like Amy said, we don't right now. We're really trying to figure it all out and moving pieces. And I think the mayor's vision for the health department has always been what the state is gearing up to be. So I think we're really trying to find ways to make it happen in a way that works for the community and for our staff. So I guess, again, I really want to make it clear that people should feel comfortable and welcome coming to my office and having these conversations. If you're feeling like you're not having direction or you want to have deeper conversations about how the health department should be structured, I think that the expertise of every staff member is invaluable, and we need to hear how you feel about the direction we're going to go in when we choose it. And I want everyone to be a part of these discussions. So please know that like our office is here for you in the now. And we need to be comfortable having these conversations. And as soon as Amy and I figure things out, or, you know, we have more health meetings here, we'll keep you guys updated as soon as we know something. We're not doing anything that's not being communicated with you. Every time something happens, I'm shooting you guys an email. So if there's anything in that email that leaves you confused or questioning things, please reach out.
And Jackie, I think let's moving forward, keep this as a standing agenda item. That way it's a natural trigger for us to continue these conversations on a monthly basis.
Okay.
Thank you. All right. So if there's no other questions, I think that moves us to agenda item number 5, new dates for monthly Board of Health meetings due to conflict with City Council meetings. So, Beth, correct me if I'm wrong, but you and I, the best days for both of us were Wednesdays. It didn't necessarily matter which Wednesday it was, as long as it was a Wednesday. Is that still accurate for you?
Yes, because it's the most predictable day in my schedule. With few exceptions, like I think there was one meeting I missed because I got stuck in the OR.
Right. Yeah. There's nothing you can do about that.
My monthly schedule, my schedule is different week to week, but that day is usually I'm done by 5-ish. Okay. But yeah, that being said, that there might be another day I can
I'm pretty stuck to Wednesdays. So I think Wednesday, if you're okay with Wednesdays, I'm like really stuck to Wednesdays. But it looks like it won't be the third Wednesday in the month anymore. If it's okay with you, I think we can move it to the second Wednesday of the month, and then it will no longer conflict with the City Council meetings. Lindsay, is that correct?
Yeah, that would be helpful. City Council is the first and third. Wednesday of each month. And we really rely on our department heads to be a part of those, especially during budget season, which is, January through June. So to avoid any conflict in the future, that would be helpful.
Yeah, so it looks like, Beth, our options are the second Wednesday of the month, which next month would be April 10th, or the 4th, which would be April 24th.
So I think for me, the second Wednesday of the month, I think would be better.
Okay.
So should I be changing our next meeting for April 10th then?
Yes.
Okay.
It might be a short agenda since it's only a few weeks from this, but I think we keep it. If there's no agenda items, we can skip that one and move to the May meeting, keeping that second Wednesday of the month.
Okay. I'll send out new links.
Thanks so much. Update on new inspector position and the use of shared services during the health agent's paternity leave. I feel like we kind of covered that in the other item.
They did interview an inspector, Brian and Emily.
Yes, yeah. I can update you on that, Amy.
Okay.
Yeah, so Emily, over the past month, she's approached me a couple times saying that there were some applicants that came in. She asked me to take a look at the applications to see if they kind of fell in line with what we're looking for. We initially did 2 interviews. Emily and I did 2 interviews on, it was roughly 2 weeks ago, and we actually decided on a gentleman, but he ultimately declined the position. And then they had another interview.
Brian, I'm sorry. So the Board of Health should be part in offering any positions.
So I'm just solely going under the guidance of Human Resources. I was approached by Human Resources. I didn't initiate these interviews at all. This was solely Human Resources.
So Lindsay, usually the Board of Health has a say on the hiring of positions because technically, I mean, per Mass General Law, they report to us. So I didn't realize that was happening, but maybe it's something we can connect with HR on. Brian, I don't think that you're directing this or leading this. I'm just.
Oh no, yeah, no. I was approached by Emily saying that she had some applicants, and she asked me to assist her because I had knowledge in what we're looking for. So I just accepted because Emily requested.
Yeah. Okay. Lindsay, maybe when you talk to Emily about this, can you mention that for the Board of Health, that the board of, at least the chair, should be communicated with and brought in before any offers are made within the department?
Absolutely. Yeah, I wasn't aware these interviews were happening either. So I didn't know any offers were even made. So I will connect. She's on vacation this week, but I'll shoot her an email and connect with her next week.
Perfect. Thanks so much. Maybe.
Yeah.
Okay.
If I could just update just a little bit more, there was another interview that was held last week after the gentleman declined. I believe it was decided that she was going to be awarded the position. I don't know if Emily reached out to her or not before she went on vacation. So I just wanted to let you guys aware of that.
Okay, Brian, can we connect tomorrow morning just so I can get the name of the applicant and stuff so I can reach out to Emily or maybe have Kira reach out?
Yeah, of course.
Thanks.
No problem.
Brian, what's their experience?
So she's been working, so she comes from working in kitchen experience, and then the past 2 companies she's worked for basically consulting companies that work for like commercial, large commercial grocery and like food establishment chains. So they do like compliance checks. So they fall under the kind of like the same. They basically act like a health inspector, but without the enforcement of a health inspector. So they work for these. They're consulting companies that are hired for these large corporate companies, and they go out and they conduct compliance checks to make sure that these companies are staying aligned and that they're set up for success for their health inspections.
So just to clarify, we're offered a part-time inspector, a position who has only food background when we're going into a camp season that we don't have a camp inspector for.
Yes, like I said, Amy, I was approached by Human Resources, and I didn't question it. I thought that everything would be done right because I was told by HR. So,
okay.
Like I said, I had no organization.
Yeah, Brian, this isn't on you whatsoever. This is on me and Emily, 100%. So don't worry about that. And okay. I'll connect with Emily.
Okay. All right. The next agenda item then. I think at that point, Brian, thank you for the update. We'll look into it, I guess.
Mm-hmm.
Okay. Health agent update. All right, Brian, you still have the floor, man.
Okay. So kind of starting with housing. So as you know, as we've stated before in previous updates, winter is usually a trend of increase of housing cases as we're entering into spring. Those numbers seem to be dropping down like they have in past years. So we're not getting as many recorded complaints weekly or monthly recently. So that's good. So we're transitioning like we usually do. To kind of go into a little bit more detail on a previous housing case that was discussed at a previous Board of Health meeting. So 97 Ferry Street, there was a subfloor area that needed to be replaced between a first and second floor apartment. We took the owner to court. We went on January 22nd. I was accompanied by the city attorney and the building commissioner, BJ Church. At that time, with the attorney's help, all parties agreed to place the case on a 30-day hold and for the required work to be completed during that period. So the deadline for that work to be completed was on March 4th. Completion of the work was confirmed. And I have it here listed in my update that, however, the case will remain open until the building commissioner approves the completed work. I just got confirmation earlier this week that that was completed. So that case is officially closed out, and everything's all set with that. In January, I received my lead determinator license. So our department will now be able to handle lead housing cases again. I know when Bree left, that was something that we couldn't handle for a period of time. So we are able to handle that now. That's all I have for.
Congratulations.
Thank you. Thank you. Yeah.
We have that now back in the city.
Yeah, it was a good experience. I went out to Worcester and we actually went to like a vacant house that's owned by the city of Worcester, and we were able to test lead paint on site there. So yeah, it was a good experience.
That's great.
Yeah. So moving on to food, just to kind of highlight some new food establishments. So I'm sure many of you know Local Burger. They opened up where the old Riffs was. They were issued their Risk 4 permit on February 12th. So I know that they've been operating for about a month now. So at the Pulaski Club on Maple Street, they have a small kitchen that they previously operated themselves. They just recently moved their permit risk down to just bar only as a risk 2. And they leased out their kitchen just such as other establishments have in town, like Amy's and Luthier's and stuff like that. So there's a small business called Annie's Kitchen. They just received their permit on March 7th. They opened up last week. Park Hill Orchard, they will be starting to build out a large cider processing center next to their existing farm stand. I've already been in communication with the owners regarding what's required for both the food code and Title V requirements. I believe they intend to have it operating by 2025. They have a large barn next to the right of their farm stand. I haven't been there, but I'm not sure if it was demolished, but they did get a demolition permit to demolish that old barn and build a new cider processing center in place of it. In the process of kind of dealing with Park Hill Orchard, going through their file, I discovered that the pasteurization process that they have for their cider was never approved by the Board of Health in the past. So I know under the food code, any juice that goes through a pasteurization process has to have a plan with the Board of Health to prove that it meets those requirements. So I am in the process of communicating with the owners to get them on the agenda in the near future. I have expressed to them that it's the ideal for them to get on the agenda before I leave in June because they start the cider process in September. I have expressed to them that they can add that disclaimer on their labels, but they do a pasteurization process and they do say it meets what the food code requires. So they're in the process of consulting with somebody and creating a HACCP plan. And then we've already talked about this already, but we'll be receiving the assistance from the regional services to help us get back on track with our food inspections. They'll be conducting routine inspections as well as re-inspections. They'll be tracked with a spreadsheet that is shared between myself and the regional inspectors. I'll also be tracking this information in our in-house department spreadsheets as well. If there are any immediate emergencies that these inspectors encounter while they're out and about, they're supposed to contact me first. I don't know if there's any questions for food before I move on to camps. Yeah, go ahead, Amy.
Sorry. So for the HACCP plan that's coming from the cider folks, so they'll submit that, you'll review it, and then they'll bring it to the board for approval.
Correct. Yeah.
Do you know? I can't remember. Honestly, I've been out of the food code for so long. Does that require a variance in our code?
That's a good question. I believe it does.
So maybe for the April meeting, you could look into that and then maybe update Beth and I on what, if it does require a variance, kind of what the process is for that.
Okay. Yeah. Yeah. Awesome. Absolutely. Yeah.
Thank you.
No problem. Rolling on into camps. So we are on track for, I haven't listed 11, but I believe the number is at 10 right now. Because one of the camps, it was thought it was going to be a camp, but after communicating with the state, it was determined that they wouldn't fall under that category. So I believe we're right around 10 permitted, which 7 of them would be hosted at Williston. So you have your 3 annual regulars in town, which are Arcadia, Nonotuck, and then Show Circus Studio hosts a summer camp. They're in the Paragon building. And then the rest, Williston has their own camp now, but the rest of them, the remaining 6 are from various companies. There's a bunch of sports camps, lacrosse, swim. There's a dance camp. There's a couple new ones this year. There's a fencing camp. Yeah, so there's all different types. I actually just sent out our annual camp memo to all our camp operators. The memo highlights just kind of a refresher on the important information about the application and permitting process, because it can get pretty complicated. And we also, what Bree initiated 2 years ago, we still keep that in place. There's a mandatory PowerPoint presentation for all camp operators So in April, I'll be holding 3 presentations, all the same presentation, but spread out so that way with people's availability, they'll have a date to pick. And at least one representative from each camp is required to attend. And it's just a good way to refresh them on specifically what's required. Because if anyone's familiar with camps, it's a lot. So, and then with my leave, I'll be most likely absent for all of the camp season. So I know the plan is for me to get all of the hopefully get all of the applications and all of the supporting documentation, like all of the policies and procedures, the stuff that is the most time consuming in the inspection. I'm hoping to get all of that submitted by all of the camps prior to me leaving. So that way, at least a majority of the paperwork side of things can be completed. And then the remaining part should just be hopefully just the in-person physical inspection. And then just kind of in general, as we enter into the spring, and especially now with the help of the shared services, my focus will shift to getting on top of the routine inspections for food, body art, and tanning. And that's all I have.
All right. Thanks, Brian. I have a quick question.
Sure.
So I know the camp code changed on March 1st. Have you guys taken any trainings or are up to date with those edits?
So there hasn't, as far as I know, there hasn't been any trainings held yet. There are trainings scheduled in some point in time in April. I have it on my calendar already. I think the state sent out an email out not that long ago with a training that's being held in April for the updates to the camp code. I know, yeah, there's like 3 categories that the updates fall under, I believe.
Yeah, administration and the consent to administer medication. So like that, I think will be important for Christine as you are looking, because I imagine, Christine, you're going to be reviewing the I forget the term that they use, the health, Brian.
The vaccine records and all that.
Yeah, but there's a term for like reviewing the like certifications of the medical director of the camp. That's what I'm looking for. And then the supervision and operation of like the high risk camps. Brian, do we have any high risk camps in town?
I mean, I'm not sure if the only thing I can think of, I'm not sure if fencing falls under high risk.
I don't think so. It's more
because I know we don't have any. Well, I guess Arcadia, they do use canoes.
Okay.
So I'm not sure if that qualifies as high risk.
I don't think that falls under high risk. They would need we'd need to make sure they're following, Christian law and making sure like the life jackets, preservers. But
I did do that last year.
I think the high risk is like horseback riding or bow and
archery, firearms.
Yeah, firearms.
Yeah, I don't. Yeah, as far as I'm concerned, we don't have anything. There's no camps that have any of those types of activities, or like there's no rock wall climbing or anything like that.
Okay. The one thing to look at is if they're doing field trips. So like when you're reviewing their brochures, so they may not do those high risk activities on site, but some of the field trips for some of the may include those high risk activities. So that's just one thing to keep in mind because they would still need to have a plan for those. And then the last part of the edits, I believe, are just like technical stuff that are just scattered through. So I think even though I'm hoping that you'll be here for that training. I wish I could remember. I think there's just all it's a bunch in April, I think is when they're doing it all. So you'll still be here. And I think that might help in reviewing the applications. I think it's like April 3rd, April 11th, like across the state, there's just different.
Yeah. Days. I have one right here. April 4th. I have it on my calendar.
Great. So Christine, I think it's probably good also for you to attend one of those, just because one of the changes revolve around the medical piece.
Sure. Yeah, that sounds good.
Lindsay has something. She's got her hand raised. Lindsay?
Yeah. So I guess I need to make the Board of Health aware also that the mayor and I put a spending freeze on the health department while we figure out their budget, unless it was something that was previously previously promised throughout the budget season. So like we will continue to reimburse Liz for her clinical supervisions under ARPA funding. But their education and training line, Jackie, correct me if I'm wrong, I think only has $100 left in it for the fiscal year, which goes until July 1. So I just want the board to be aware that we had put a freeze on spending until we get a better grasp of what we're going to be doing in terms of the department as a whole right now. But if these trainings are within $25 things, and we can send Christine and we can send Brian and stay within that $100 mark, absolutely, we can do that. If not, then I guess I would ask for support from the board to do appropriations out of free cash once that's certified.
Okay.
We do have, I did see, Lindsay, I did see an expense report, and we've not used any of our advertising budget, which I think is like $200. And we only, in the past, the only advertising that we do is usually for a hearing, and I don't see one coming up before the fiscal year at the moment. So we would
so
be
that's
able
something
to, we could, yeah.
And Lindsay, these might be free because the code has changed. These might be state sponsored.
Great.
Because it's a code change. It's not like something that we're, but I can certainly look into that. If there's, Brian, I'm sure can look tomorrow and see if they're.
As far as I'm aware, the one that I'm signed up on April 4th, there's no cost associated with it. There was no invoice or anything. I just registered and I was able to put it on my calendar. So
perfect. Okay. Great. So Christine, if you don't have information for those trainings, I think it's going to come out in the OLRH newsletter tomorrow. So I'll have the Office of Local Regional Health, and if not, Brian can get it too.
Okay. Sounds good.
Great. All right, Brian, thank you for your update. Who's next?
I'm next.
You.
You got a copy of my report, correct?
Mm-hmm. Mm-hmm.
Okay, so you don't need me to go through all this, right?
You certainly don't need to read it, but if there's something that you want to call out, I can see like the Maven, the cases that have come through Maven, the illness update.
As far as the Maven update, I just had a question. Do you want that to be like like a calendar month? Like for the next meeting, do you want me to just give you like March's Maven report? It just might be a little bit cleaner than, because it'll be wrapped up by March will be wrapped up by the next meeting.
Sure. Yeah, that's
probably that's the best way to do it. Okay.
Or if you want to do it quarterly, unless there's a trend or something you want us to be aware of.
Unless something comes up where
if you see a massive spike in Lyme, and we could do some public education around arborviruses and prevention and protection. Like I'd love to know that. Maybe we should do that. I know we're short on staff, so I'm like pipe visioning maybe, but if there's a local like anybody that you want to get in front of, or even the schools, and talk about how we can protect ourselves from arborviruses as we move into that tick season.
Absolutely.
That could never hurt. But in terms of the Maven report, I think quarterly is fine, unless Beth, you feel differently.
No, I think that makes sense. I think when we were in the height of COVID, it probably made sense to have these more frequent, but.
Plus, I don't think that the numbers reflect the true COVID numbers or flu numbers. It's just
right.
So, unless it's something that required a big investigation, I figure you can just use it quarterly. That would be sufficient. The big thing in the respiratory is that the CDC decreased the isolation time for COVID. And everybody knows about that.
But the state has not changed their guidance yet. So we still follow the state's guidance.
Yeah. So, and
if anyone listens to this after it's on the website or recording.
Okay. Good point. Thank you.
Yeah.
And then the rest is just that I'm doing some presentations at the library, the Council on Aging. And then I just did one at Learn to Cope. And I'm just out there just trying to see where I can do some health education kind of thing. So
that's great.
That's about it.
So awesome to see the outreach and the preventative work that you're doing. Well, thank you for the update.
All right. You're welcome.
All right. I'm out of the agenda. Trying to.
Liz, I'm next.
Liz.
Hi. My children may squawk throughout this. I apologize. It's kind of the
Ryan, see what you have to look forward to? Kids squawking. yelling,
Yeah. I have sometimes it's like parrots or, an a cappella group. It just goes with it. So I sent you guys kind of an abridged version of what's going on. I have a million referrals right now for a variety of things, but housing is consistently, the top question, whether it's people who are trying to move to Easthampton, people who are trying to stay in Easthampton, people who are unhoused in Easthampton, people who are in shelter with some of our community partners that are Easthampton residents who will be returning to the community when the winter sheltering ends, which is, I believe everybody who is in Easthampton, if they return to Easthampton, will be back on or around April 1st. What I have gathered from some of our residents, we have a lot of landlords who are selling or have sold houses and properties that they have rented to people for a long time because it's a really great time to be a landlord, I guess, and make some money. So places are being sold. Families are desperately looking, but it's, affordable is not always affordable for people. So we have, hold on one second. Let me see if I can assist my child here. We have a number of people who are facing evictions in the next couple weeks. I have been to housing court. I have talked to a lot of people. Unfortunately, we just have a lot of people who are really struggling right now. So I don't know that there's a good answer. It's just that, it is a really hot topic for social work in Easthampton of, how do we keep these kids connected to our school systems and the supports that they access. There are some protections if you fall under some of the homeless and unhoused regulations with children, but it's challenging. I do the municipal briefings with the governor's office every month to hear about, what's available to the Western region. But it's a day-to-day conversation. So we do have a number of people who are reaching out for help around that. Tapestry had reached out to talk about moving forward with the arrangements that we had started with them. And Lindsay and I had talked about it briefly, and she was going to reach out to Liz Wynot, who's the director for Tapestry. Unfortunately, for the moment, because of budgeting and everything, that's going to be put on hold for the community, which is a bummer. Because they want to do their mobile van services, but also had reached out with some info about the public health vending machines that they do, which would be really cool. But I think, and I don't know if Lindsay may have more information on whether or not she talked to Liz, but we were sort of at a pause with that.
Okay. Liz, do you know if it's is it definitely free?
So they had reached out indicating that they would need some funds from Easthampton to contribute to a variety of, just like different, they were looking for an amount of money to cover some of the expenses that will come with offering services to Easthampton. So that's where the pause on this kind of came from, just because it's budget season. And so I don't know that if there were further conversations between Tapestry and the mayor's office about what that figure would be.
Okay. So I think it's on hold until Lindsay can have the conversation to see what the cost actually is and if our free cash has the enough to cover it. Okay. Liz, can you plan to update us on this in April's meeting? Sure. Like check in if Lindsay's not going to be here, check in with the mayor's office and see where we stand and if there's any update.
Sure.
Because I think this is a great service, and I think it sounds like you have the capacity to something that you can own. Is this something you have the capacity to own?
Oh, for sure. And I'm happy to do it. They're really enthusiastic about coming to Easthampton. They're already serving a ton of our residents in our neighboring communities of Holyoke and Northampton. I think it's a win-win for everybody. I think it's just a question of money and how it will officially be rolled out. So.
Okay, great. So let's update it next month. It sounds like we have the capacity within our department. It's really just if there's the funds to cover it. So hopefully next month we get some good updates there. Thank you.
And then the final thing that came up, and it came up last year too, going into the warm weather, we do not have a porta potty or any available public restrooms downtown for people in Easthampton, families that are out and about, seniors that are out and about. It's a question that comes up quite a bit. Like, what are people supposed to do if you're out enjoying Easthampton and we don't have a place for you to use a restroom? The restrooms that exist over by Mill Pond are typically locked. The camp restrooms are only open when camp is in session and there's campers there. Complaints came in last year because some of our unhoused residents who are outside, at some point in the day, you are going to need to do your business, and people complain that it's a public health concern because what if people are urinating or defecating outside, but we're not offering a porta potty at 50 Payson or along the bike path. And there's a lot of people that pass through town. So it came up in discussions last summer, and the concern was two concerns that had come up just in discussions at City Hall. One was leaving a porta potty unlocked, that someone could overdose or something could happen while they're in there and no one might know they're in there, but also that could happen in a lot of places in Easthampton. And the other piece was the financial component of like paying for a porta potty to be at 50 Payson or somewhere downtown. And I know typically most companies will clean them every like week or 2 weeks, whatever kind of a schedule you put them on. I just think that for the number of people that are out and about in Easthampton when the weather is nice, it's just a common courtesy, and it is a public health problem if people are doing what they need to do outside and we don't have a public restroom. So I just thought it was something that we ought to be talking about. There is typically a porta potty in the 50 Payson parking lot, but only for the farmers market, and it's only unlocked during the farmers market. So it's something that affects people of all ages, and I just thought it was something we should revisit before the weather gets really nice, because I think we'll get more public health complaints. But it's not just for unhoused residents. Like, everybody at some point needs to go to the bathroom.
Lindsay has her hand raised again.
So
Amy.
interestingly enough, yeah, we had a group come to us several weeks ago about the porta potty concern. And so myself, City Council President Gomez, and a representative from Easthampton Police Department met with them. And I also discussed this with the mayor. So the concern is not only financial, but it is the upkeep. What if it becomes unsanitary? Then we have to have staff that are cleaning it, which would require another staff member out of our building ops department. And that 50 Payson Ave is a public space. It's owned by our residents, not by city staff. And it is open Monday through Thursday, 7:30 to 5:30. And even later with night meetings going on. So that is a space for people to use a restroom. And Parks and Rec should have their bathrooms open. So I'm happy to connect with John Mason about that. And then just to note that the farmers market purchases and pays for the cleaning and services of their porta potty. That is not owned by the city. And there is a porta potty down at the boat launch off of Water Lane, and that's owned and operated by DCR. So we do have some options, but the city isn't in a position, I don't think, without support of the Board of Health, to create another job position and financially support a porta potty at 50 Payson.
Do we think, so I know that there's like the two restrooms at Mill Pond, and we get Park and Rec to open them when we host our overdose awareness vigil there, and those are great. I think the biggest thing was weekends when there's so many people out and about, we don't have anything that's open. So I'm wondering if those restrooms, because they're like off the bike path and can they just be open on the weekend? Or I don't know if that adds another task to Park and Rec. I don't want to put this on any of our staff because I know everybody has so much going on already. I just was thinking, like, my parents have a seasonal business and they rent a porta potty, and the company comes out once every 2 weeks. They clean it, they restock it, they make sure that it's taken care of. It's relatively inexpensive. So I was just thinking it would be it would be unfortunate if it gets trashed or is a mess within the time frame of the people coming back to take care of it. And I don't want to put this on, DPW or Park and Rec or anybody. It's just, it comes up a lot when the weather's nice. And we had a lot of public health complaints last year that residents thought people were defecating outside and wanted to know why we weren't doing something about it. But there's not really a place for people to go on the weekend. That's all.
I would certainly help advocate for keeping Mill Pond and at Nonotuck open. I don't know what that takes, but since we already have them here and accessible and in use, that's a conversation to have for sure. I just think that the porta potty conversation has been talked about several times under this administration and turned down, but I, certainly defer to the Board of Health.
I think it would be great, Lindsay, if we started with utilizing the resources that we already have, in terms of the Park and Recs one and the one at the park. I think my kids have used that when we've been on the bike path. I don't know why it was open, but it was open. I was like, thank goodness it's here. So I don't know if we could start there, Lindsay, and then see if that could be a very low-hanging fruit option.
Yeah, Liz, we can connect tomorrow and I can get some emails started.
Yeah, that'd be great. Thanks. Those are the three big topics for me for right now.
Thanks.
Can I say something? I was just thinking too that like Eastworks building, like when that's open, when the businesses are open there, like the bathrooms there are communal bathrooms for anyone who's right. Like you have to, I think I was at Prodigy recently. Like you have to walk like really far down the hall to the bathroom. Like they're not specific to the businesses. So I don't know if that's something, we probably can't promote that, but but I don't know if they're considered public or you have to be.
Yeah, I think my only thought, and I was thinking about them, and I was in Eastworks recently and like walked by the restroom. It's just that they have, they have the sign on the door that says like parking is for tenants only, like that kind of thing. I just didn't want anybody to get in trouble if you're not a tenant or like doing business in the building. If you are somebody who just, frequently stops in to use the restroom, if they would be upset with anybody and give you a hard time. But, I guess I agree with you. Like, I don't know that they would advertise it, but I also don't know that they would be upset if somebody, especially like if it's just, you're in and out and there's no issue.
Right.
So it was on the brain because it came up quite a bit last year when the weather was nice. And I just didn't want people to be given a hard time if they're like outside and don't have another option. That's all.
Okay. Thank you. Hunter, bring us home.
Yes. Sorry, I haven't talked at all during this meeting. All right. So the first thing on my agenda, the Massachusetts Community Health and Healthy Aging Funds. We're currently in the process of finishing the proposal. It'll be submitted by the end of the month. That's due to the due date being March 29th. So literally at the end of next week. I said that we would likely have it submitted before this Board of Health meeting, but I don't know how vague I have to be. I'll err on the side of caution. There was some slight hiccups with certain aspects of the project, but we're over those hiccups and moving in the right direction. We can talk more about that like privately or something along those lines, just because I don't want to give personal information out. Anyways, so there's that. Hopefully we get those funds and we'll hear back in July, I believe, if we do or not. And that has some big capacity behind it. It'd be close to, hopefully, if we get the full amount, 125,000 for 4 years. So each year, or 3 to 5 years. Anyways, so the second thing on my list, unless there's questions to do with that, great. Kratom, I just wanted to bring up some research / work I've been doing on Kratom just briefly. So Kratom is a very complicated substance. I think I submitted a fact sheet. In small dosages, it has cocaine-like stimulant effects, but in large dosages, it mirrors opioid-like effects. So you have a lot of people who try to wean off of opioids by using Kratom. It's been on the rise in the US for the past couple decades. It's like a plant native to Southeast Asia. And the CDC every year receives more and more calls to do with Kratom poisoning because it's completely unregulated. It's mostly up to states and local municipalities to do stuff. So I found out about it because Belchertown recently had their Board of Health passed some regulation to do with that. So I did put that as well, but we don't have to talk about that today because we are short Board of Health members and we don't have a health director. So, but
I actually like to talk about it.
Oh, great. All right.
Can you, for next month, can you reach out to some of maybe the more progressive communities in our state that like were front and center on Tobacco 21? So I like Northampton, Brookline, Needham.
Tobacco 21, you said?
Yeah.
I think I heard about that today, actually.
Yeah, there are some communities across our state that are just like usually leading the charge when it comes to kind of any initiatives like this. And I'd love to know kind of like what they're doing. And if you, Hunter, you can email me if you don't know what communities those are, and I'll reach out to the tobacco coordinator at the state and see who, or MHOA, Sarah McCaughlin at MHOA is the tobacco coordinator. You could send her a quick email about like what were the first 10 communities that went 21 plus on their tobacco. And then I would reach out to those communities to see what they're doing on this substance.
Okay.
Because they were also the ones who were front and center on the whole cannabis charge. So if you could bring that information, I think even though we're short a board member and even though we don't have a director, we can still do work around these kind of emerging to substances to keep our kids and safe. So I think this is a great, I haven't even heard of it. So I appreciate you bringing this to our attention.
Yeah. Yeah, and I went around, I have a memo attached as well. Yes. I went around Easthampton locations to see if we had any vendors currently selling Kratom, because I met with Councilman Zarrett, and he recommended that I do that as a sort of next action step. So I went through all the dispensaries in town, and many of the gas stations and convenience stores. So I did find that Valley Farms was currently selling it. It's behind the counter, but they have multiple packages of Kratom. So I thought I would just bring that up too. And I definitely can do that. I was also, this isn't on my memo, if I can bring this up real fast. I just had my executive committee before this, and one of them brought up Delta 8, which I know has been rising in conversation as an unregulated substance similar to Kratom. So I think it'd be worth considering that simultaneously.
Let's do it. If you're reaching out to these communities and we're trying to get a sense on what they're doing on Kratom, certainly while we're already talking to them, we could find out if they're doing anything on something 8. I don't know.
Yeah, synthetic cannabinoids. So
I'm so old, guys. I don't even know any of these things.
It's you're not old.
I've heard of Kratom, but that's just because I used to work in addiction medicine. So
okay. Yeah, so I can definitely do that for next time.
Awesome. Thanks, Hunter. I appreciate that.
And then, so my next agenda item, Battle of the Bands. So this project I'm working on right now, it's been fun because I got to make some advertisements and use some of my Photoshop and Illustrator skills, but in Canva. But so we have a tentative date for July 20th. I'm collaborating with Parks and Rec. We were discussing options for having food trucks and stuff, which I've talked to Brian about, just because I want to make sure they're pre-approved for we're not approving people when we have short inspection staff. So yeah, I'm currently still looking for bands for that. Right now I have about 10 people that have reached back to me. I'll stop accepting names for bands on April 15th and then go through a like auditioning practice to filter the bands and groups. So yeah, can I bring up an agenda item that's not on this?
Before you do that, I just have a quick question. I'm just curious, where are you thinking about doing this? Millside
Park.
That's what I figured because they've got the little, cool.
Yeah, so we're going to do it there. It's going to be a dry event in terms of we're not going to have alcohol vendors. Of course, abandoned brewery is right next door, so I can't stop people from going there and coming back. But yeah. And just real fast, it's not on my list, but I have some executive committee members for my coalition who we're kind of thinking about doing some kind of youth led a community cleanup event sometime soon, so that's something that I'm going to start planning. We have some committee members who walk on the bike path who notice all the litter and trash and want to do something about it, which I took a walk on the bike path the other day and did see how much litter there was. So kind of thinking, you know, in terms, Earth Day's just around the corner, unfortunately, but I'm going to reach out to our neighboring communities and seeing what they're doing for Earth Day, and possibly seeing if there's any like sort of initiative they're doing that we can just kind of emulate.
Awesome. Hunter, that's a great idea. If there's anything the board can do to help, let us know.
Great.
Nips, lots of nips.
Exactly. That's what my main constituent has been. Well, I'm not voted in, but my main executive committee member has been bringing up. So 100%.
All right. Well, thank you, Hunter.
Thank you.
That's our last item on the agenda. So before we close, I just want to thank everybody again for all the hard work. I know it's hard being without a director and being understaffed, and it adds a lot of extra work and a lot of extra stress to the things that you're doing. And the Board of Health appreciates all the efforts that you guys have to protect the residents in our community. So thank you. With that, Beth, I will entertain a motion.
Yeah, I will echo what you just said. Thank you, everybody. We will get there. Yes, I will make a motion to end today's Board of Health meeting at 6:40 p.m.
Excellent. I will second that out of necessity. Amy, yes.
Beth, yes.
This government meeting is brought to you by Eastworks and our local cable subscribers.